BF.7 is a variant of concern. What do we mean by variant of concern and how is it different from variant of interest? We say that a variant is a variant of concern if it is actually causing four things. One is it is causing more infection. Secondly, it is having an immune escape mechanism, that is those who already had COVID or the vaccine are still getting infection. Third is it is causing more hospitalization or deaths. And fourthly, if it has the ability to not escape the current available testing mechanisms. What we see with the BF.7 is that it causes more infection, it is more infectious, it spreads more rapidly than the previous strain. And secondly, it has the phenomena of immune escape, that is, even if you had the vaccine or had COVID in the past, you can still get infected with the BF.7. So it is definitely a variant of concern, and that is why one is closely monitoring to see how it behaves in the community in terms of causing an increase in number of cases and causing more cases in those who have already been vaccinated. The difference in India and China is there. India has a good vaccination coverage, especially the first and second dose. Many of us, or I'll say a large part of our population, has got natural infection, and therefore we have a good immunity. And therefore, although we will get infection with this new variant, and we can get infection, it is not going to be very severe. Having said that, those who are in the high risk, the elderly or those who have comorbidities, should be careful, because all infections, all viral infections can be little severe in these individuals, and they need to monitor themselves closely. Currently, we are in a good situation. There are hardly any admissions and really no deaths as far as COVID is concerned in our country, but we need to be very vigilant and keep a close watch, because we know the virus can mutate and things can change quickly. So when we look at vaccines, it's important to understand what are we talking about in terms of effectiveness. Do vaccines prevent us from getting the infection? Do they prevent us from getting the disease, which can cause severe problems in terms of hospitalization, ICU admissions or death? And do they decrease the transmission of the disease? Currently, the vaccines are effective against the new variant as far as severity of disease is concerned, hospitalization is concerned, death is concerned. So if you are vaccinated, you may still get the infection, but it will be a mild infection. You will get the infection will be in your nose and throat, but because of the vaccine induced immunity, the body's immune system will not allow the infection to spread and will not allow it to turn into a severe disease. So vaccine will prevent you against severe disease, against death, but it will not prevent you totally against getting the infection, and that is important for us to understand. I would really urge everyone who has not taken the booster to come forward and take the booster dose. There is data which suggests that the booster does help. It does give you protection against severe disease, even against the new circulating variants, because remember, they're all originating from the Omicron variant, and we have data that these vaccines do work against the Omicron variant. Therefore, if you have not taken your booster shot, please come forward and take the booster shot. It will protect you against severe disease, and it can be life-saving. So there have been a lot of rumors going around on social media. The symptoms of this new variant are very different, but the data does not support that. If you look at data of the symptoms that is emerging from countries and even of cases that have been reported from our own country, the symptoms are very similar: fever, cold, sore throat, running nose, blocked nose, cough and body aches. So these are the symptoms which we see normally with coronavirus, and this new variant BF.7 is also a part of the coronavirus and is having very, very similar symptoms. So I would really say that if you have symptoms which suggest that it could be COVID infection, then it is important that you get tested. And when we talk of tested, I would say it's important that you go and get an RT-PCR test done. And this is for two reasons. One is that you would know whether you have COVID or not. And if you have COVID, then whether we need to just give symptomatic treatment in the form of paracetamol, hydration, multivitamins and anti-allergic, or if you are in the high risk group or you have features which suggest that the disease may be more severe, then whether we need to give other drugs which are specific for the COVID infection. Also, if you are positive, then the sample can be sent for genome sequencing, and one will know what is the variant that has caused the infection, and that will help our country in knowing what are the circulating variants in our own country, and what is the action that we need to take. Currently, that is not happening. Most people are not getting themselves tested by RT-PCR, and we therefore don't know for sure how much is this new variant in our country, or is there any other circulating variant as far as India is concerned. So this is the time of the year where you have respiratory infections. Fever, cough, cold occur because of many respiratory infections, including influenza and COVID. And for a normal person, even for physicians at times, it's difficult to differentiate whether this fever, cough and cold is because of COVID, or is whether it's influenza or from any other viral infection. So if you have fever which is moderate to high grade going on for more than 2 days, cough, sore throat, running nose, lot of body aches, I think it's important that you get yourself tested to see whether you have COVID. Some people actually get both tests done. They get a test done for COVID and for influenza to really find out whether you have influenza or COVID, because there are different treatment for the two viral infections. So I think it's important that if you have fever and cough persisting for more than 2 days along with sore throat, you should get yourself tested. So what the data that has emerged over the last few years is that the most vulnerable group is the older age group. So the elderly people, those among over 70, 80 years of age, are very vulnerable, and they need to be extra careful. So they have to be careful that whenever they go out, they should always wear their mask, wash their hands properly, and if possible, avoid going to crowded places, especially indoor crowded places where there is poor ventilation and high chance of the virus being present in the environment there, causing infection. So I would really say that the older age group needs to be careful. After that, we need to really look at those who have comorbidities, those who have uncontrolled diabetes, who have heart disease, who have chronic kidney disease and are on dialysis, or patients who are on immunosuppressive therapy. They should also be extra careful.